Dr. Rajeev Chawla, Senior Consultant Diabetologist and Director, North Delhi Diabetes Center. On World Diabetes Day, I feel it's my duty to make my patients aware about existing heart risk which is there in patients of type 2 diabetes. Type 2 diabetic patients are at 2 to 3 times greater risk for having heart attacks, for developing strokes, for developing TIAs, for also developing peripheral vascular disease, which can ultimately lead on to gangrene and amputation. So all these complications, which we label it as macrovascular disease, or in a layman language you may say that large vessel disease, are more likely to happen in type 2 diabetic patients, especially if you have a poor glycemic control, especially if you smoke, especially if your cholesterol levels are on the higher side, or you have a hypertension. Unfortunately, the risk for all these large vessel diseases is much higher even before the onset of type 2 diabetes. So we say that clock for these macrovascular diseases or these cardiac diseases starts ticking almost 5 years prior to the onset of diabetes. So it is very, very important right in the beginning to screen for your cholesterols, to screen for your blood pressure, screen your urine for presence of albumin, also screen by doing an ECG, and if required or suggested by your diabetologist or physician, a treadmill or echo must be done right at the time of diagnosis. Similarly, we tell our patient that they must screen themselves for presence of any retina disease because of diabetes by getting a fundus examination. So if we screen right in the beginning and try to have a good glycemic control, good sugar control, good control of blood pressure, good control of their cholesterol, and they must stop smoking, then many times it is possible to avert or to postpone all these complications which are at a greater risk in setting of type 2 diabetes. So I think it's a very good advice to all the patients, those who are diabetic, that you must stay under the care of your physician or diabetologist, must screen for all these investigation right in the beginning, try to have HbA1c control very, very tight, maybe close to 7 or less than 7 as appropriate as advised by your physician. And you must not smoke, your blood pressure should be under good control, your cholesterol should be much below the target, and you should do a regular amount of 30 to 60 minutes of exercise on daily basis so that you can avoid getting all these complications in the future. Thank you very much.